Your hormones aren't the problem. Wait, what? You thought that all the symptoms you have in the world are down to hormone issues. If you're a man, low testosterone. If you're a woman, low estrogen. Or if you're still having a cycle, high estrogen, low progesterone. All these types of things that you've probably seen on social media, and you think that that is your main problem. Now, stay with me. I am all for hormone testing. I'm a big fan that it is crucial to test your hormones and fix them to make you feel better. However, what I have found over all these years in my functional medicine practice is that hormones are usually a side effect, a knock-on effect of deeper issues going wrong. So rather than just throwing in some hormones, you might want to address what's really going on, and then hormones often balance themselves out by themselves. Now, this is usually not the case if you are post-menopause, because then hormones, it's really difficult to get them back into balance. So I am all for a little bit of HRT, very balanced, very measured hormone replacement therapy to help you with your symptoms, but also optimize health. Actually, there's a lot of research showing that optimizing your estrogen is really beneficial, and also a little bit of testosterone often to help you long-term prevent cardiovascular disease, high cholesterol, all these types of things, brain degeneration. However, for men with low testosterone, for women in their reproductive years that have cycles, and even women post-menopause in regards to testosterone, a lot of it comes down to deeper underlying triggers that if they are addressed, everything falls back into place, including also thyroid hormones. Now, what research shows is that some of these common underlying factors are actually chronic inflammation, blood sugar issues, nutrient imbalances, chronic stress. Now, bear with me a little bit. So for example, did you know that for women, PCOS, really common problem, is very tightly linked to male prostate hyperplasia and also male pattern baldness? So they actually term them both, they're in the same bracket. They call the male issues the male version of PCOS because they have similar underlying factors. Now, one of that is that they have a high level, oftentimes, of the very potent testosterone called DHT. Now, instead of just throwing in blockers that block the conversion of testosterone into that very potent active form that can cause these issues that have potential side effects, you might actually look at what is causing that conversion to be upregulated. And it's the same stuff that I mentioned before: chronic inflammation, blood sugar issues, chronic stress levels, nutrient deficiencies or overload. Now, a really big one there is inflammation, and it's always, I talk about this all the time, you always want to look at where is this coming from. And I see this all the time in my female PCOS patients. It's not just the hormones that are the issue, it's actually chronic low-grade inflammation and blood sugar issues that are causing a lot of these issues. Now, oftentimes they're getting tested for the HbA1c, which is the average blood sugar over the last 3 to 4 months in a regular blood test. And if that comes back as normal, doctors will say this is not the problem for you. However, research shows that the normal range is really big, and we want to be in a much narrower range to really have optimal blood sugar control. And better yet would be to wear a blood sugar monitor for 2 weeks to see what your blood sugar is actually doing on a day-to-day basis after a meal, because that HbA1c actually only tells us what the average is. It doesn't tell us whether we have lots of spikes and dips. And we actually, both of them, if we have lots of spikes, but also if we have lots of dips, they can contribute to issues and cellular damage and hormone issues. Now, for low testosterone for men, oftentimes it comes also down to lifestyle factors, not enough sleep, for example. We make testosterone for the majority during our REM sleep, our dreaming stages of sleep. So if we're not getting enough sleep, that particular part of sleep, and alcohol, for example, messes with that part. So if we drink every night, and I'm all for a little bit of wine, champagne here and then, but if we're drinking every night, then we might not be getting enough of that REM sleep, and then it's really hard for the body to make testosterone. Also, exercising. A lot of the people that listen to me, they exercise, maybe even over-exercise, but there are people that's their kind of their weak link, and they might just find that really difficult to do. But if you don't move enough, if you don't build muscle, that actually also contributes to low testosterone and inflammation as well. So blood sugar issues, not moving enough, not sleeping enough, and inflammation are big ones here. Now, when it comes to women in their reproductive years, all these factors that I mentioned before, chronic inflammation, all of that can also mess with our cycle. Reason being is that when you are in your reproductive years, our body is fine-tuned towards reproduction. Even if you maybe don't want to have a baby right now or never, or you're already past that stage of wanting that, the body doesn't really distinguish between those different factors. It just, from a evolutionary perspective, we are wired to reproduce until at some point post-menopause that stops. And our hormones, our sex hormones, estrogen, progesterone, they are tightly linked to whether our brain thinks it is safe to make a baby. If the brain thinks it's safe to make a baby, it will produce the right signals to stimulate ovulation in the middle of the cycle, which will then help the body produce the right hormones in the second half of the cycle. And oftentimes it is actually if there's some kind of stressor on the body that makes the body think it's not safe, that blocks ovulation, that doesn't work well, and then in the second part of the cycle we have all these symptoms that people often just put down to hormone issues, and they can often be due to not enough progesterone or low optimal progesterone, or estrogen in comparison to progesterone being slightly too high because there isn't enough progesterone to balance it out, or estrogen not being broken down properly. All these things can cause a lot of these issues that we often relate to hormone imbalance, estrogen dominance, as we want to call it, fibroid cyst, endometriosis, short cycles, heavy periods. A lot of that has to do with hormone issues, but we don't just want to, in particular during that time of the life, oftentimes we just want to work on the basics, fix ovulation, make the body feel safe, and then oftentimes that second part of the cycle will actually take care of itself. A lot of issues are also due to estrogen not being broken down properly. And it's not just so much about the actual estrogen levels, but how the body's breaking it down. And that also has to do with all these factors that I mentioned before: underlying inflammation, blood sugar issues, nutrient imbalances, toxic load. So in my practice, I always look at where is this coming from? What's the underlying factor? Until, like I said, there's the exception for women. In their perimenopause, it often stops if their progesterone is really low and they're just not ovulating and they have a stressful life. Then I am all for a little bit of progesterone. And then once estrogen drops, also a little bit of estrogen. Testosterone, women have a lot of benefit from that if it is low, but usually just doing the right lifestyle factors and fixing the root cause. Generally, I see in my practice that testosterone comes back really quickly, rebounds, even in women post-menopause. So that one, sometimes I put it in a little bit and then stop when everything's been fixed. I hope you found this helpful. Comment below, I'd love to hear